Hello, and this is going to be our presentation over presentations. I think that we included this in here because we all have our different styles, different techniques. We can always improve. I really do hope that you take a lot of these things to heart. Nothing's more annoying than seeing a presentation with 50,000 words on it and you can't read any of it because it's super small. The font you can't read because it's a different color. It's a black background with dark red lettering. These are all things that we can improve in stylistic because really when you get out into, poster world, regional presentation world, as well as when you get into the workforce and you have to deliver a presentation, if you are trying to get money for a grant, if you're trying to get a promotion, if you're trying to demonstrate competency, if you do not provide a good presentation that has excellent elements and you're able to accurately convey the point without too much ado, then you essentially have just wasted all of your time and you may not get the result that you want. So presentations are very important. They are meant to be a vehicle, not the journey. And so the journey is you. You are the presenter. And so these are just going to be tips and tricks, on how to deliver a great lecture and how to make sure that you are conveying points. So one of the first things about a great lecture is that you have to keep people entertained. And you can do this with a number of things, stories, you can do it with memes, and that's a really popular theme in residency is memes. So let's look at one of them. So this is an excellent example of what not to do. For example, you have been given an assignment. Your assignment is to present hypertension. Your hypertension lecture should last an hour. So you, the night before, decide to make it a PowerPoint about hypertension, and you have literally just copied and pasted up to date and added some pithy sayings in there that really do not matter in terms of enriching anyone's knowledge, but instead you just have to fill an hour. So the first thing is that you need to make sure that the lecture that you're given, at least be interested in it, and at least try to make sure that you demonstrate interest. Do not say things like, this is going to be a boring lecture, I know this is boring, I know that you don't like this. Those types of settings set up you for failure, and they just make everyone not interested at all in learning anything that what you have to say, and you're wasting their time and you're wasting your time. So please set the stage for success and say that, I'm happy to deliver this to you, and let's try to get something out of it. I know that we've already learned a lot about this, but there's always opportunity for knowledge. So it's about how you deliver the presentation, which is important. So what makes a bad lecture? Well, the audience can't see you. If you're sitting in the back of the room and you're delivering a presentation, no one's going to really care to see what you have to say because they can't see who's delivering it to you. Now, obviously, this is a virtual lecture. You can't see me. But at the same time, this is meant to be a preemptive thing, and it's not necessarily going to be a true presentation as it would be that you're delivering in front of your colleagues and your superiors. So the audience can't hear or understand you. If there's something wrong with the microphone, or you have a problem with English as a second language or whatnot, then you need to really practice your slides in order to deliver the content effectively so that everyone in the audience can understand. The presenter is flustered and nervous. If you haven't presented this at all and you don't know what you're talking about, people will know and they'll just probably tune you out. So again, practice makes perfect. There are many stories about even some of the attendings that have utilized other attendings before their grand rounds to say, hey, can you just sit in the lecture hall and listen to me deliver this so that they can practice it and work out the kinks. The presenter is not enthusiastic. This is a really big one. We understand that sometimes you have to deliver topics that you just are not interested in at all, and that's fine, but that's life. There are things that you're going to have to do that you don't want to do. Obviously, medical school was a big one. If I could just be a doctor at the beginning, I would have just done that. But you have to endure. And in order to endure, you must demonstrate that you are doing something that you want to do. I mean, obviously, you're in residency. You want to be a doctor. This is just part of it. So you need to demonstrate enthusiasm. And how do you do that? You say, like I mentioned before, if you have a topic that you're not truly interested in, just be like, I learned a lot of things from this. I hope that you all do, and move on. Do not dwell on the negatives. The presentation's not interesting. If I give you a presentation that is just essentially white background, no color, nothing, no pictures, no memes, nothing at all, and it's just text after text after text, that's kind of boring. So you need to make sure that you are gearing your presentations to the audience, that you have a multimodal audio-visual presentation. So let's talk about the requirements of a memorable lecture. They're divided into 5 classes. The preparation phase, making sure that you don't overload your slides, that you're the one that's supplementing the slides, not the slides supplementing you. Practicing engaging the audience and closing with a good content. So how to introduce things. You got to decide about what you're going to talk about. You need to make an engaging introduction to set a clear agenda for the audience to follow. At the start of your presentation, you should make it clear whether or not you would prefer to deal with questions as you go along or at the end of the presentation. You should not end a presentation with, do you have any questions? I mean, you've led up to the whole thing and then all of a sudden it's like, all right, does anyone have any questions? All right, click done. You should ask questions as you go on. You should pose questions to the audience in order to engage the audience. Don't just talk to them. No one likes being talked at. You have to engage them with questions. So the next thing is a core message. You need to use an outline of your main points and have at least 3 to 5 main points to support, just like an essay. If you think about writing a presentation in PowerPoint like you would write an essay, you're going to have 3 to 5 main body paragraphs, and those are what your core messages should be. Now, obviously, you need to have a penumbra, a message that is going to encapsulate everything that you're talking about. For example, hypertension would be the core message, and then after that, it would need to be, how do you treat it? What do you use to maintain it? What do you use to screen for it? And those are the sub-messages within. Time. Have a subject you can actually cover in the time period. Make sure that if you're talking about geriatric dermatology, you're not going to be able to cover pathophys, 10 different diagnoses, and treatment in 30 minutes. So pick an area like a diagnosis, or even maybe in the diagnosis talk about a couple different things, but don't try to cover the whole presentation and the whole topic all at once. So this is another big one, right? Spock saying you got 320 PowerPoint slides and you're going to sit here until it's over. You have to really make sure that if you have 320 slides in an hour, it's not going to happen. You're not going to do it. Don't sit there and believe, well, I have 150 slides and we're going to be able to get through it. You need to have a maximum of 60 to 70 slides. And really, if you think about it, if you talk a lot, then having a minute per slide may be pushing it too. So you might need to cut it down. Try going through it. That's the preparation phase and the practice phase. If you're going over your time, you got to cut slides or reduce the content. Technology. If you're using technology, have backups. Don't just say, well, I've uploaded my stuff up to Google Drive or I have it on my email, because the internet may be down that day. The computers may not work. Well, what are you going to do then? You know, you have to anticipate problems and you have to go and do a pre-screen, and that's the preparation phase where you go in and you get into the room, you see where the technology is, you ask questions about how it works, you know who to call if there's a problem. And you have to make sure that if you do have technology problems, that you have maybe a verbal background. You have your slides printed out, or you can look at them on your phone and you can give an oral presentation. There's a story about one of our other colleagues going to another institution, and they had the power went out and they still had to deliver the presentation, and they had to deliver it from scratch. So there was no visual component, it was all auditory. So being able to go on the fly is very important. So, you know, you could use puppets, but that may not be conducive to knowledge. So visuals, right? Effective visuals and analogies, demonstrations, examples, getting people involved, thinking about billboards and why they're so effective. If you have a billboard with 100 words on it, no one's going to be able to read it. Billboards, like, to me, the first thing that comes to mind is that made you look, that type of thing, and it's trying to sell the billboard to future people that want to sell their products. And so if you're using the PowerPoint, put the meaning or message in the headline and say something important. Number every page. Use numbers or letters instead of bullets. Typography matters. If you have a very large text, which you see right here, you know you're on visuals. You know we've already talked about other things. And changing the font or colors for emphasis, or even using some of the actions in the PowerPoint, is very important to convey a good message. So which side of the slide has more of your attention right here? The slide of the mimosa or the text? Well, to be honest, I'd rather look at the picture than read the text. I can read, but I don't usually get to see a mimosa every day. So understanding that these are the things that are going to draw your reader's attention, and text in a picture does not mean that that's going to draw your attention. If you have a photo that you can describe and you can, describe what's going on, like for example, I can say you see the mimosa here, it's pretty, it's pink, it's got a really long stem, it looks like a fiber optic cable, then you can say, oh, well, the picture has now given me 1,000 words, and the person will most likely remember what I talked about that. Other thing, people are not going to be interested over long periods of time. Make sure that you're engaging them. And obviously you can't use the sprinklers, but if you're asking them a question like, what do you think, or what do you think the most common cause of STD transmission is? And just actively engaging the audience is very important in order to make sure that people are still checked in, or else they will check out and it's just a waste of time. So less is more. Do not write full sentences. You need to limit your main points to 5 or 6 and concentrate on the essentials. It's staccato speech. You don't want to provide a paragraph unless it's extremely necessary, and most of the time it's not. This is another thing. If you read a slide, and look at this slide's got 5 main points, that's cool, it's got a graph, it looks like a white paper that you're trying to, just have someone read after you've published it. You can't read a slide word for word, and you should not have your slides be your documentation background. I understand that in medical school, slides were an alternative to education because that was the alternative to the textbook. That is not the point of your presentation. Your presentation is meant to supplement you and your knowledge. It is not meant to provide an alternative because, to be honest, very little people are going to print out your slides and review them diligently because they want to score well in a test. So stop thinking in terms of medical school and start thinking in terms of presentation capabilities for the general public. As if you were giving a presentation to the general public and you want them to be interested, you're trying to sell a product. That should be the method and the mentality behind every presentation you give. I'm trying to sell something. What can I do to make it feel interesting? So let's talk about PowerPoint slide rules. The 10-20-30 rule, okay? It's quite simple. A PowerPoint presentation should have 10 slides, last no more than 20 minutes, and contain no font smaller than 30 pica, okay? So a 6x6 is 6 bullets or less per slide and 6 words or less per bullet. Number rather than using bullet points. That's kind of hard, when you think about how can I fit hypertension into 10 slides? Well, it's completely possible, and you can do it if you work hard, but you must be able to avoid this. Okay, this is too much text, and it's overwhelming. No one wants to read it. It's like, what's the point? Literally, it's just so that you can read it off. If you have this much text, then you can put it in the speaker notes, and be careful because a lot of the computers do not enable you to do slide presentation mode where you can just type your entire speech in this PowerPoint. You need to be able to convey the message without having slide cards, and that comes with practice. The other example is this. I don't need any bullets because I have so many graphs and pie graphs and charts, and I can explain everything. Well, this is also very overwhelming. Making sure that you're not overwhelming your audience with visuals. So less is more. Colors, right? Use high contrast color combinations. Black background, white text. Gray background, white text. If you see right here, this purple, it kind of fades in a little bit. It's a contrasting color, but it's still dark to dark. But you want to make sure that color combinations that colorblind viewers can't see are avoided. Red and green and blue. But at the same time, in medicine, not many of us are red, green, blue colorblind, but that's for general purpose. Solid colors are really good. Make sure that you're watching for your readability that you're going through, and understanding that a presentation that's delivered over a projector is different than a presentation that's delivered over a TV. If you give a presentation over a projector, that bulb might be going out, and your white or yellow text may become like this really light white, and no one can read your slides. So making sure that high contrast colors are used. Now, here's an example of black on black. So you have white on white and black on black, and no one really can read this. And it's going to be very difficult for people sitting at the back row who are somewhat have advanced age. and they will be able to read this. They'll say, oh, it's a pretty picture. What are they talking about? How do you practice? You read it out loud and you practice in front of people, and you can also record yourself. This practicing lectures out loud and timing yourself helps you to keep on target for time. Asking a friend to listen to you and critique what you're saying is also very important, because then as you're reading, you can find spelling errors and stylistic errors that you know would not work in normal time. Recording yourself in video, it can be a fun thing, man, this journey during residency or medical school, whatever, and it helps you identify the use of like, and whatnot. I struggle with it. I have to think about it every time I make one of these lectures, not to say and as you can hear it in other lectures that I've been giving you, like, I will say and like. It's hard to kick that because unfortunately that's our colloquial speech. So making sure that you remove those from your vernacular when you give a presentation makes your presentation more professional. Have someone listening to you and clicking on you whenever you are making mistakes will also help to remind you that I need to use proper professional speech. Your gestures are also very important too. One of the best things that you can do when you're giving a PowerPoint slide is to use the indicator right here, like this. And you can use this on a PowerPoint on the bottom. It's the laser pointer feature. If you're giving a virtual presentation, you're not going to be able to use a physical laser pointer, because obviously anyone who's tuned in will not see your laser pointer that you're using in the real world. So it's always best practice that if you're giving a PowerPoint presentation and it's digital, that you use the digital tools like the laser point or the pen or the highlighter to make sure that people know that you are doing things that everyone can visualize. So this is a good thing right here. This is residency. We got a little telephone. We got someone who's, man, I don't want to be here. Oh, and then the other important thing that we forgot to mention is the laptop that everyone's using because everyone's doing their charts. So, and then you have this guy right here. And meanwhile, you're just trying to push through, talk about your hypertension lecture. So this is not the goal. This will happen, but this is not the goal. The goal is that you want to turn this graph and then take a little board, a little break, little board, little break, chunks and checks, and you keep it going on here. This is not the process. So make sure that you have things that keep people involved and entertained. So keep people entertained. Engaging with eye contact. Making sure that you smile and it helps your audience to relax, that you're having a good time, that you're relaxed. People pay attention and trust more that the speaker knows what they're talking about if you do make eye contact. But it's not a staring contest. Staring contests are very uncomfortable. Do not stare at one person. Pick 5 or 6 to move your focus around as you engage the entire audience. Make sure that your voice is enthusiastic, that you vary intonation and pitch, that you're moving around and you're using gestures. If you have a clicker, you can do that. Do not just stay in one spot with your head down reading your slide notes. That was not a good engagement. So humor, when it's appropriate. Do not use humor that you are uncomfortable with. Make sure that you're not going to offend anybody. Offensive humor is sexual, toilet talk, things like that that are inappropriate. If it bridges on a sexual content in this environment, it could offend somebody and get you in hot water. So a joke, right? Don't talk about religion, politics, race, age, money, technology, men, women, children, plants, animals, or food. Well, obviously we don't have to go that far, but usually if it's vulgar or it can be construed as vulgar, then you probably should not put it in your presentation for a professional presentation. This would be an example of a vulgar, inappropriate joke. You cannot do this, okay? Someone may be offended and you may be in trouble. So remember, if it's vulgar or sexual, then it is not going to be in your presentation, okay? Even if your friends think it's funny, it's not appropriate. So personalization, right? Stories from your experiences. There was this presentation's from Dr. Davis, and she had to give the same student mini lecture twice a day for 4.5 days. For me, whenever I teach in university, it's the same lectures every year, every semester, and thankfully I have a year, or excuse me, a semester in between lectures. But you have to remember that they pretty much know this lecture, front and back if they've delivered it a lot, and they may become bored with it. And if you are in that situation, then it's time to make a change to the lecture. Think about, maybe I can include different things, maybe I can focus on different things, maybe I can add or remove things. So always remember, if you're giving the lecture, a similar lecture that you've done before, try to make it different for you, to make it exciting for you as well. Asking questions to yourself, to the audience, listening carefully to the question. If the audience is large, repeat it to make sure that everyone knows what they're talking about and everyone knows what the question was. To make a hard question seem easier, you can pause, breathe slowly. This will give you time to think and then answer while looking the questioner in the eye. So it's really important that you understand that if you have board review questions in there, then that is a good way to get people involved in the lecture. So there's a good way to do this is, if you have a question that you don't know what to do or what to answer, and if you are in a collegiate environment where you have colleagues that you know about, then for example, you can say, well, I noticed that, Dr. So-and-so or Professor so-and-so is in the room. I wonder if he'd like to comment, since he's somewhat of a subject matter expert. Obviously, do not use it as a professional weapon to put someone else on the spot. But if you do, honestly, like for example, Dr. Bowen is very good with skin, and Dr. Shadwar is very good with colonoscopies and endoscopies, and Dr. Davis is very good with aesthetics. These are all things that you can incorporate as your phone a friend kind of a thing. Another thing that you can do is that, I'm not sure about that. I will get back to you. If you'd like to come back to me at the end and I'll provide me with your email address, I'll be more than happy to look that up and give you the information. That is a collegiate response. And don't say, I don't know. That's not going to be satisfactory. So you need to have a response, a rebuttal. And most of the time, it's a collegiate, parring match. They'll be like, okay, and then you'll be like, hey, you know, like, no, I'm okay. So you have to play the game. So board review, right? To be able to give a good presentation, a full rehearsal is A, necessary, B, optimal, C, audience-based, or D, useless. You need to include those board review questions with the right response and be able to explain them. You should have, at least in a collegiate environment like this, you need to have at least 3 or 4 good ones to describe it. And another thing that you could also think about is starting with a scenario-based presentation. And what that is that you start off with, I have a 75-year-old female, her blood pressure is 150/70, she's had a history of stroke and claudication in bilateral extremities. What do we do? Start it off with a question and then launch into your presentation. That's a good, what they call, icebreaker. So you're going to have interspersed and at the end and maybe at the beginning to include the presentation and in the include the presentation in the party's visual range so that they can stay engaged. So to make a presentation effective and impressive, you should use simple and effective active form, complex jargon, or passive sentences. Obviously, it's A. And why do we do that? Because people just want to keep to the simple stuff, 6 words and less than 6 bullets and 10, 20, 30, 10 slides, 20 minutes, and 30 pica. So those are the things, simple, active, that you can use to draw the audience in and keep them there. To select the content of your presentation, you should know the available material the audience needs, the time limit, and your purpose. Absolutely all of them. All of them. And that should be E. So if you don't know your material and you don't know the audience that you're presenting to, you don't know how long you're supposed to, you could write a 350 slide presentation over hypertension when you only have 20 minutes. So making sure that you know these 4 things before you write something or do something is very important. You should not close with question and answer session. Most people are done with the presentation at this point in time. When you finish answering questions, make sure that you have the last word with a strong insertion of your main message. That's a conclusion slide. In other words, you can thank the audience for their questions and summarize once again the main point that your presentation was designed to communicate. Thereby, you leave the audience with the main point. You don't leave the audience with silence. So let's talk about closing. You're going to state the main ideas to take away from the presentation, review those main points, and review the muddiest points and clarify. You have to have enough foresight to realize what is going to be the most muddiest points, and also how are you going to simplify that for the audience. So summarize. The do not forget collection, if this is where they would say, if I could take away one thing from this lecture, it would be X. So that's a good point to make whenever you make the presentation. Also re-summarizing the main points, the muddiest points, and asking, at the end of it, if you have any questions, I'll be more than happy to answer them after the presentation. Remember, do not leave with silence. Yeah, so, and yeah. It needs to be a little bit more spectacular than that. So let's talk about the requirements of a valuable presentation. Prepare. Less is more. Practice, engage, and close appropriately. Make sure that you know what you're talking about, you know the place that you're going, you know how you're going to have backups if anything's happening. The 10 slides in 20 minutes and 30 pica font, and the 6x6 less than 6 bullets and less than 6 words per bullet using numbers per bullet. Practicing either coaching, recording yourself, making sure that you remove the like, and yeah. In addition to that, we are making sure that you're getting other people look and watch you practice so that they can give you some critiques as well. Engaging the audience with questions, making eye contact, talking to people, and making sure that they are not checked out. You want them to be checked in. And then not closing with a question and answer session. Instead, you're closing with the summary of what you've been talking about, reviewing the points as well as the more complicated points, and simplifying it for the person. Tell them what you're going to say it, then tell them what you said. It's that sandwich approach, okay? This is the tool, the most effective tool to get your presentations noticed, remembered, and you are able to convey the point of to what you're trying to do. Anyway, that is the presentation, and if you have any questions, we look forward to them at all, and thank you so much.